The truth about dental implants, the cost, the process, and what to expect. I'm going to give you a quick rundown on all these topics and some of the most commonly asked questions I get from patients at our practice. What are dental implants? In a nutshell, a dental implant is a titanium post or screw that we essentially place into the bone, typically kind of underneath the gums. It's as simple as that. Just like you would take a screw and place it into a piece of wood, it's literally kind of the same thing with your jawbone. Now remember, the dental implant itself is just this little post or screw and does not include initially the connector piece or the tooth that we put on top of it. How does this differ from a bridge versus a partial denture? So if we're looking to replace missing teeth, one option is of course to place the dental implants to replace just those teeth. If we don't want to do implants, then another alternative would be the bridge, which is where we basically grind down or crown the adjacent teeth to the missing area and then have kind of all of those crowns or units connected together. So imagine basically 3 crowns kind of all soldered or connected together, and that would be the bridge, which is cemented in place. It does not come in and out, but you have to floss underneath it. You can't really floss in between it, and you are still at the end of the day using the adjacent teeth to hook on an anchor to. The other option is a partial denture, which is something that you take in and out and replaces the missing teeth that we want to replace. Now, one good thing about the partial denture is it's kind of the most bang for your buck, because if you have multiple missing teeth on that arch, then you can replace all those teeth with the partial. But at the end of the day, it is something that you take in and out. And so sometimes it just feels a little bit more foreign, and sometimes patients just don't really like that. When is a dental implant really recommended? The things that we're looking for, the most important thing is the patient a good candidate as far as just overall health wise? And then secondly, is the area a good site to place a dental implant? What does the bone quality look like? What's the bone width, the bone height? Is there space for even the tooth to go there? And then of course, we really want to weigh what's important to the patient as far as, do they want something that stays in around the clock? Do they want something that they could just take in and out? They want to have some flexibility. They want to basically limit the number of times or hopefully problems they're going to have down the road, which of course everybody does. Ideally, what is going to be the best treatment for them based off of what's important to them, and then the costs, and of course, if they're able to make it work. A step-by-step process and the timeline overview for the dental implant. So if you are already missing a tooth, from the time the dental implant is placed to when the permanent tooth is basically on there, I tell patients to allow basically about 3 to 4 months. Now, this could vary depending on where you are in the mouth, but in general, if you're missing a tooth, then it's going to be about 3 to 4 months till the permanent one is on there. Now, if you have to get a tooth extracted, where let's say a tooth broke off of the gum line, and you know you want to get a dental implant placed, but you got to extract it first, I tell patients to budget maybe around 6 to 8 months. Again, this could vary depending on where you are in the mouth and the dentist that you see, but I would budget around 8 months. That's typically what I tell patients. Now, if you're somebody who falls in that other category, as far as somebody who has to have the tooth extracted first, your dentist might talk to you about a bone graft. What is a bone graft, and do you really need it? In general, so when we take a tooth out, there's of course a big hole there. And so what the bone graft is literally we take kind of little particles of bone or collagen and basically fill that hole, or basically pack it back up with material, which kind of helps serves as a scaffold and kind of jumpstarts the healing. Now, the bone graft is an elective procedure typically. So it's not like something that you typically always have to do. And sometimes after the tooth comes out, you may not really even need the graft. But in general, one of the main takeaways is that the bone in the gum is going to heal better with the graft than without it. And so if you're somebody who is considering a dental implant, then I typically encourage patients to get it done. So that's their overall time frame. The first phase is to place the dental implant, let it heal, or extract the tooth, place the dental implant, let it heal, and then make the tooth. If you've ever wondered if dental implants are right for you, drop your biggest question in the comments below and I will go through and get those answered for y'all. Quick favor, give this video a thumbs up and consider subscribing to the channel. That way more people who are searching similar info can find it as well. How much do dental implants cost? So this is going to of course vary depending on where you live, but I ballpark patients at our practice about $5,000, which it might make your jaw drop, which I know seems expensive, but keep in mind that the major costs incurred with that are typically about 1/4 of that is going to be the dental implant itself. Then there's going to be the connector piece that goes on the implant. Then there's going to be the tooth that sits on the connector piece. And then there's kind of the other miscellaneous things as far as like the consultation, the x-ray, things like that. So I tell patients without insurance, it's about $5,000. If you have insurance, even if they don't cover anything, it's going to start being whittled down from there. Keep in mind too, this is typically phased. So, like we talked about, it's not like you have to pay $5,000 all at one day. It's like, we place the implant, pay the expected portion, let it heal, then it's time to make the tooth. And so it is broken up over time. I've had patients too who have waited a year or maybe even 2 years before we've put a tooth on it so they could save and get it done. Why do dental implants cost more upfront? I don't think that there's one concrete answer to this, but in general, placing the dental implant is a more advanced dental procedure, which requires the dentist to have more advanced training and or go to courses to be able to do, typically to have better technology in order to do it very well to the level of that we'd want it to do it for patients to have success. There's obviously the added liability for the dentist to do these procedures, the lab bills for the teeth, as far as what our costs are just to make the teeth and all the different parts that we use to connect them, scan the screws, everything just starts to go up. And so that's kind of how you get to that number. One of the most important things that I talk with our patients about is to really view it from a long-term investment perspective. And we're not trying to sell anything. Genuinely, that's not our goal. What our goal is to do the best treatment that will hold up the best for the patient over time. And so if you have to replace a missing tooth, yes, the dental implant is always going to be the most on paper. But 5 years, 10 years, 15 years from now, if the dental implant is still in there, how much more could you potentially spend if you did something else, only to then circle back to maybe want to do implants down the road? And so it's not the best option for everybody, but in general, when you view it from a long-term investment perspective, it tends to become more appealing because it should hold up very well over time. Does insurance cover it, or what are some financing options? So insurance will cover those different parts to different degrees. So you've got the implant, which they may or may not pay for, the connector piece, which they may or may not pay for, and then the tooth, which they may or may not pay for. And even if you're in network, then it might even be discounted a little bit from there. And then you could always talk to your dentist. A lot of patients at our practice, fortunately are able to pay for this procedure, or they have coverage that definitely reduces their cost burden, and or they are able to utilize care credit or another third-party financing in order to get it done in a time frame that works for them. Do dental implants hurt? They really shouldn't. You should be numb during the procedure. But in general, keep in mind you are having a surgical procedure done. So if you had a procedure done anywhere else on your body, your knees, your hips, your shoulders, you would expect to be sore like a couple days, probably even a couple of weeks afterwards, even if you are feeling good. And so I tell patients to expect the same thing. The dental implants we place in our practice are all guided surgeries. All that means is that it's much more kind of precise, and we don't have to manipulate the gum and the bone quite as much. And so patients in general do very well after the procedure. They're out working in the garden, walking the next day. Yes, they're sore, but typically ibuprofen or Tylenol covers it. Yes, there are the more complicated kind of patients or areas that we do that we know are a little bit more surgical, a little more difficult, or depending on the patient's overall health, how they heal, how they respond. They could be more sore, but in general, I'd say if we placed 100 implants, I'd say 90% of those patients are going to be feeling well. Over-the-counter medicine covers it and kind of not interrupt their normal routine. Do you have to be knocked out for the procedure? Typically not. So usually what we'll do is we just numb it locally, just like if you were getting a filling or a crown done. Now, if we're doing multiple units or we're extracting multiple teeth and then doing kind of more leveling the bone, doing a lot more kind of extensive kind of surgical things, then typically a lot of patients will want to do the IV sedation, which is basically just where they start an IV and you're kind of asleep for the procedure. I have had patients who've wanted to do the IV just for the single implant, but in general, most patients will just do the local. And with the guide, usually it's a 15 or 20 minute procedure and then they're on their way. How long do dental implants last? There are a lot of studies reviewing a bunch of studies that show that around the 15-year survival rate of implants is around 95%. So like at year 10, it was around a 96%. Year 15, it's around like 94, 95%. In general, they typically are going very predictable and have a very high success rate. Now, a lot of that is going to depend on, of course, how is the patient a great candidate to begin with? Is the area a good area to place the implant? How well is it placed? And then, of course, how well is it taken care of? So there's a lot of things that affect the long-term success. But in general, if we check a lot of those boxes that I just mentioned, it should work well and hold up very well over time. How to care for dental implants. So dental implants are not bulletproof. They will not decay. But one of the big problems that they can have is basically just foundationally with the gum and the bone around them. And so you take care of them just like you would any of your teeth. Really, you've got to brush them. You've got to floss them. It's recommended that you go see your dentist routinely to make sure that everything looks healthy. Sometimes they'll go in and maybe irrigate kind of the gums around the implant, maybe do some other adjunct therapies. And then, of course, check the bite to make sure that the stress is being distributed where it needs to be to help kind of minimize the amount of stress and force that's being placed on the implant compared to the adjacent teeth. Some risk factors that affect the longevity, kind of like we mentioned earlier, some things that I see as far as the longevity, excessive force on the implants, like patients who are hitting too tall on the implants or are really big clinchers, grinders. Too much force on implants can cause problems. And a lot of that too has to do with the crowns coming off, screws breaking, the tooth loosening up. Other factors that affect the longevity would be maybe the angle of the implant. If it's kind of placed at a funky angle, then the force is being put on it at a different axis. Smoking, systemic disease, uncontrolled systemic disease, such as like diabetes, along with others, poor oral hygiene. A lot of times maybe a combination of things. Maybe it's not necessarily just one. Those are some factors that affect the longevity, but your dentist should be having these conversations with you prior to the placement as far as, are you even a good candidate? And then Of course, if you're seeing them and following up with them, then hopefully you don't check the boxes for too many of those risk factors as far as affecting the longevity of the implant. Who is not a good candidate for a dental implant? With dental implants, there's a thing called contraindications, which is basically where we don't want to go in there and place a dental implant on this person. Some of those people that kind of check the box as far as contraindications would be the uncontrolled systemic disease, such as like uncontrolled diabetes, hypertension, someone who's had a recent heart attack or major surgery, someone who's undergoing head or neck radiation, chemotherapy, taking immunosuppression drugs. And then of course there's the other things as far as the area's got an active infection, if the area is just not a good site. Those are contraindications. Now, some other things as far as just risk factors where it's not a reason not to do the procedure, but it's definitely requires some additional clarity and conversation between the dentist and the patient just to say, hey, there's some other risks involved here, would be controlled diabetes, cardiovascular disease, patients who have taken bisphosphonate therapy, for osteoporosis, smoking, alcohol, periodontal disease, poor oral hygiene, age, occlusal stress, just different things like that. Like I mentioned, the most important thing is just taking all these factors into consideration before even placing it. And then hopefully as you're seeing that patient over time, you're staying on top of these. And so you're not really doing anything that's going to be too risky or placing an implant in patients that can have problems. Now, I will say, so personal story as far as how long the implants last, all the implants that we've placed in our practice the patients have pretty much had success with. Now, there are a few kind of those relative contraindications in patients where we did the surgery guided. We knew it was going to be a tight space. It was just going to be a tough procedure, a tough area to place it. We discussed the pros and cons with the patient. The patient was still okay. And I thought it was worth it to try and place the implant, and it just didn't work out. Those are really the only failures that we've had in our practice as far as those areas that are just really difficult. And myself and the patient knew it going into it. We still thought it was worth a try. And then we moved on to something else. So some common questions or myths that I get asked about from patients. Will I be toothless for months? No, you will not. Now, if it's a back tooth and it's not really a big deal to you to have that missing, then yeah, a lot of times patients will just go without a tooth. Now, as the further forward we go in the mouth, your dentist will be able to make you something that replaces the missing tooth or teeth until, I call them get me bys, until we have the permanent tooth on the dental implant. So a lot of these will either be an Essex retainer or a flipper, which are basically things you take in and out that have teeth on them. So that looks like there are teeth there. Now, there's probably more people walking around with these than you realize. Other people probably wouldn't even realize that you're actually wearing it, but that's kind of our best option. Now, as we go further in the mouth, sometimes up front, after we place the dental implant, if it checks a lot of boxes and meets certain criteria, sometimes we can place a temporary on these types of implants. Just like you'd have a temporary placed when you do a crown sometimes with front teeth, we can place the implant, put a connector piece on it, and provisionalize or put a temporary there while you're healing. But that's not an all the time thing. And so in general, I tell patients, you will not be without a tooth if it's important to you to not be without a tooth. And we will make you something most likely that you take in and out to kind of get you by until we have the permanent tooth done. Can my body reject the implant? If you're a great candidate and it's placed well, the odds are it's going to be a successful procedure. I have had some patients, or have read some studies, patients who have metal allergies, to like titanium. If they have a patient has a response to the titanium in the dental implant, then that could be a potential kind of cause of failure. So that's really what I see as far as if the body rejects it, or there's just other problems as far as the site itself is just not the best site and the body's like, nope, it's not going to work. Another common question I get is, what if the implant fails? Like, are you going to like double dip and keep charging me to try and redo these implants or graft or do the bridge? There's a lot of different ways to handle it. And it's kind of, there's no right or wrong on this. Typically what we do in our practice, assuming we've done everything we can on our end to place it well, to do it well, the patient's done everything they can on their end to take care of it. They haven't had any falls or trauma or gotten in a fight or something. Then what we'll do is apply what they've paid towards the implant towards the alternative treatment or therapy. So let's just say, for example, we placed an implant. For whatever reason, we had a problem with it. Whatever they paid towards the implant, then typically we would allocate that amount or a large portion of that amount towards the alternative therapy, such as the bridge or the partial. That way, it's not, the patient doesn't feel like they're spending all this money trying all these options that may or may not work. That's going to differ between each provider, how they handle it, but that's how I like to handle our practice. So, all these were guided surgeries that we've placed and are still holding up very, very well. And we're continuing to see in our routine hygiene and recall visits. So this last little section is, what I would tell my own family if they were considering dental implants. Now, we treat every patient at our practice like we do families. So this is what I tell patients at our practice. Find somebody that you trust. Ask the doctor about their experience, their training, their courses, different things that they've done. If it's a routine procedure that they do, if there's anybody else that they know who's had success with the procedure there. So find somebody who you feel confident in performing the procedure. Somebody who has explained kind of the process to you as far as, are you a good candidate? Is the site a good site? Here are some kind of the risks or the complications involved. Basically, that they've kind of laid it all out there as far as the pros and cons options. And then lastly, kind of what is most important to you, the patient? You know, do you want something that is going to be in there for the long haul, something that is going to feel more like your natural tooth? Do you not really care? Do you want just something you're going to take in and out? You don't want to spend that kind of money on it. And then making the best decision for you in your mouth, in your wallet, of course. Yeah, thank you guys for watching the video. Hopefully you got some valuable tidbits or information on that. We make these videos to help you guys however we can. If you're going to be replacing a tooth or at least still weighing your options, be sure to check out one of our other videos where we review a dental implant versus the bridge, which one is better, and dive in a little bit deeper into each of those options. If you have any more questions, there's more resources in the description below. And if you're local, feel free to reach out. We'll help you however we can. Thank you guys for your time.